let's talk about a lipid panel and what it contains. Lipids are fats that are in the body and can contribute to things like heart attacks, strokes, and some other conditions like pancreatitis and diabetes. The first value that is looked at in the lipid panel is the total cholesterol. Cholesterol is found in foods of animal origin, such as red meats and processed meats. Cholesterol is a crucial component of your cell membranes, is used in the formation of hormones like estrogen and testosterone. It helps make vitamin D and is needed to produce bile acids for digestion. In addition, cholesterol is an important part of the myelin sheath, which is the protective covering around nerve fibers. We will look at the subtypes of cholesterol, but for total cholesterol, the desirable level is under 200 milligrams per deciliter. Readings from 200 to 239 milligrams per deciliter are considered borderline high, and levels of 240 milligrams per deciliter or above are considered high. When evaluating a lipid panel, three key types of cholesterol are HDL, LDL, and VLDL. Each has a distinct role in the body, and interpreting their laboratory values helps assess cardiovascular risk. HDL is known as good cholesterol. It participates in reverse cholesterol transport, meaning it helps carry cholesterol away from blood vessels back to the liver for removal. Higher levels of HDL are protective against heart disease. In adults, an optimal HDL level is considered 60 milligrams per deciliter or higher. For men, an HDL below 40 milligrams per deciliter is considered low. For women, an HDL below 50 milligrams per deciliter is considered low. Lower HDL is associated with increased cardiovascular risk. In addition to eating a healthy diet, exercise can also increase HDL levels. In addition, smoking lowers HDL levels, so quitting smoking can make improvements in this number. LDL is commonly referred to as the bad cholesterol because elevated levels contribute to atherosclerosis and increased risk of heart disease. LDL carries cholesterol to tissues, but excess circulating LDL can deposit in vessel walls and form plaques. The optimal LDL level is less than 100 milligrams per deciliter for adults. Borderline high is from 130 to 159 milligrams per deciliter, high is 160, 189 milligrams per deciliter, and very high is 190 milligrams per deciliter or more. For people with existing heart disease or high risk, lower LDL targets may be set, sometimes below 70 milligrams per deciliter. Lifestyle factors that can help to lower LDL cholesterol include reducing consumption of saturated and trans fats and increasing your fiber intake. Exercise also impacts LDL levels by helping to lower them. Smoking and alcohol also help to raise LDL levels, so limiting these will help improve cholesterol levels. VLDL transports triglycerides synthesized in the liver to peripheral tissues. Like LDL, VLDL also contributes to plaque buildup and is considered atherogenic. Normally, VLDL is not measured directly, but estimated as 1/5 of the triglyceride value. A normal VLDL is less than 30 milligrams per deciliter. Values at or above 30 milligrams per deciliter are considered elevated and are often seen with high triglycerides, which also confer increased cardiovascular risk. When reviewing a lipid panel, triglycerides are another essential component to assess. Triglycerides are a type of fat or lipid found in your blood. They are stored in fat cells and can be used as an energy source between meals. After you eat, your body converts excess calories, especially from carbohydrates and alcohol, into triglycerides. A normal fasting triglyceride level is less than 150 mg per deciliter. Levels between 150 and 199 mg per deciliter are considered borderline high. 499 mg per deciliter is high, and 500 mg per deciliter or greater is very high. Elevated triglycerides are a marker for increased risk of cardiovascular disease and, at very high levels defined typically above 1,000 mg per deciliter, can also increase the risk of acute pancreatitis. Several factors can raise triglyceride levels, including obesity, poorly controlled diabetes, physical inactivity, excessive alcohol intake, high carbohydrate diets, and certain medications, such as corticosteroids, beta blockers, and estrogens. Genetics also play a role. Conversely, regular physical activity, weight loss, limiting sugar and refined carbohydrates Managing diabetes and reducing alcohol consumption can help lower triglyceride levels. Some medicines, like statins and fibrates, are prescribed when lifestyle changes are not enough. Understanding the values and the breakdown of the subtypes of cholesterol is very important to understanding a patient's health. There are types of cholesterol that may be important to our cell and hormone structure and are good for us.